Hey Guy, I thought I have a few minutes to share with you some of those guys been practicing for a while and the comparing and evaluating the orthodontist case on the basis concept of class 1, class 2 occlusion. Sometimes you guy been out for a long time and you don't have that practical experience evaluate the ortho case. I have a little bit of time. This is a case where it looked very easy, but it's actually kind of interesting how to evaluate the patient and how to improve the case. This patient have a deep bite case, all right? So deep bite case. Usually deep bite, always there's some reason why there's deep bite going on. So let's focus on this, and I'm going to jump right into detail. Look at this case together. As you can see that on the right side, the buccal cusp, mesobuccal cusp of the upper is not at the buccal grooves of the lower first molar. So you can see first molar on the upper is not aligned with the first molar of this mandibular. That's the reason why we call molar class 2 occlusion. Remember, if you look at this side, this is the example of the correct class 1 occlusion, where the buccal cusp of the upper arch, first molar, is aligned with the buccal grooves of the lower molar. And this is very important. And you can see that it will determine how the canine on this side look like. So the canine, because the molar is class 1, it make the class 1 canine on this side as well. But as you can see on this side, because the molar is forward, the class 2, that's why the canine is actually not in class 2, is not in class 1 occlusion. It's have been moved a little bit halfway toward the anterior region, creating the deep bite for the patient. Even though this patient doesn't have a severe deep bite, but it's actually create about 40 to 60% deep bite right now. So when you evaluate the patient, you have to look at the molar concept, molar occlusion. So again, so how do we fix this? As you can see on the left side, we don't want to change any position of the from canine to molar on this side. So we need to stabilize them. And the goal of this case is to fix the deep bite and correct the class 2 canine is to actually move the molar back to fix that. So how do we do that? We need to use, once we straighten the patient teeth, we can do elastic to class 2 cross bite, and it's going to be fixed. People say, oh, I don't care about my tooth. It looks fine. Let me just talk about this a little bit. You can see that this art, if you look at the occlusal view on the left side, we mentioned that left side have class 1 occlusion, right? So you can see that the alignment of the molar to canine is really nice alignment. And then you look at the alignment of the right side, you can see that it looks straight here, but the canine is buccally or facially inclined and doesn't have enough room to come in, as you can see. So when you do braces, the goal is to stabilize all of these here. Don't want to change it, don't want it to move farther. But what you have to, once you stabilize with whatever technique you're using, whether Invisalign or braces, these sides have to be stabilized. And the goal is you got to move this molar back, and that's where you can bring the canine in, and then you can fix the class 1 occlusion on this side as well. So the other thing, when you talk to a patient, that you can say that, or patients say, oh, I don't need braces. Let me show you why. Patient, if he or she thinking about a long term, whenever the case is have the issue with occlusion, the tendency that patient have the either moderate to severe incisor worn out, and this will eventually will wear the teeth out more, and eventually there is crack line and the damage of the incisor teeth. Eventually it will turn into other issue. So yes, even though right now patient kind of young, doesn't seem to be needed any restoration treatment, but in long term, these two teeth will get damaged because they are not aligned, and the parafunctional habit of the teeth, upper and lower, causing the significant wearing of the incisor, and eventually dentin can expose, teeth can be sensitive, or even crack enamel can occur. So again, just want to show you guys this case. Just take my time, 5 minutes, to explain to you guys. I'm hoping that those of you interested in braces, orthodontist treatment, and want to learn more about evaluating the case, you should be able to do it, and you should be able to improve your patient case if you understand the concept of braces. Again, this case can be definitely improve after braces. Not only the deep bite situation, the occlusion, but it's gonna turn out beautiful smile, and patient gonna have very attractive smile and a confident long-term result. Again, I'm hoping that you guys follow my channel and continue help support this channel to grow, and I will be invite expert in implant dentistry, braces, oral surgery, prosthodontist, and dental consultant to share their wisdom and knowledge and experience to you guys. Hope to see you next video.